So today's question is, I'm under so much stress at work that I think I'm going to have a nervous breakdown. What exactly is a nervous breakdown, and can you get one from stress? Workplace stress is a common problem that affects many people in many different ways. And, it can result from various factors such as high workload, tight deadlines, lack of support, poor communication, conflict with colleagues or managers, or lack of support from managers. Now, while some stress can be motivating and beneficial, too much stress can have negative consequences on both your physical and your mental health. We all know that. A nervous breakdown is sometimes also called a mental breakdown, and it's a term that's used to describe an intense period of mental or emotional distress that leaves you unable to function effectively in everyday life. Now, although it's not a clinical term, it's even not a specific mental health diagnosis. It often describes a situation in which an individual experiences overwhelming stress, anxiety, or depression, and this prevents them from properly managing their daily responsibilities. Now, work related stress can significantly contribute to the risk of having a nervous breakdown. Of course, it can. High demands, long hours, unrealistic expectations, job security, a lack of support from colleagues or managers, this can all lead to chronic stress. Now, when this stress accumulates over time, it can exhaust a person's emotional and physical resources, and this increases the likelihood of a nervous breakdown. Now, recognizing the signs is essential for early intervention and for recovery. So, some common indicators would be persistent feelings of being completely overwhelmed, feeling completely helpless, feeling despair, as well as feelings of anxiety, panic, and irritability. You get mood swings when you're on the road to a nervous breakdown. Cognitive symptoms would be things like difficulty concentrating, racing thoughts, constant worry about work, and coping with your workload. And these can all be warning signs. And alongside these emotional and cognitive signs are physical symptoms which go along with it, such as feeling tired all the time, not sleeping properly, loss of appetite, heart palpitations, and even bursting into tears for absolutely no reason. Now, I hear people say to me all the time, no, 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 I'm emotionally resilient. I thrive on stress. This definitely won't happen to me. I'm strong. And this is great, but emotional resilience doesn't guarantee immunity from experiencing a nervous breakdown, or any mental health issue for that matter. Even the most resilient individuals can encounter situations or stressors that overwhelm their capacity to cope. And prolonged exposure to stress and relentlessly high expectations can lead to emotional exhaustion and, in some cases, a nervous breakdown. It's not something to be scoffed at. It's really important to pay attention to these signs and ask for help if you see them, preferably from a mental health professional. A nervous breakdown, I know we use the term flippantly, oh, I'm going to have a nervous breakdown, but in reality, it is no joke. So if you experience any of those symptoms, go ask for help.